Hi, my name is Valentine Chena, and I'm here to demonstrate fluid and medication administration. I will first start by identifying my patient. Can you verbalize your name and date of birth? And I'll use your wristband. His name tallies with my record. I'll provide privacy, perform heart hygiene, and don't choreograph. I'll also confirm the doctor's orders that I have, and the doctor's orders tallies with the medication that the fluid and medication that I have. I have done my calculation, and the fluid is supposed to be given 150 ml in 60 minutes, and I'll be using a micro drip, which is 15 drops per minute. So I'll be giving 38 drops per minute for the fluid. The amoxicillin, I'll be giving 100 ml in 15 seconds. It's 250 milligrams in 100 ml. So, and I'll be using a micro drip. So I will be giving 100 ml per minute. So I'll go ahead and confirm that the 6 types of medication administration, which is the right patient, right drug, right time, right patient, right drug, right dose, right time, right route, right documentation. I'll also confirm that my patient does not have any allergies to the medication that I'm about to provide, which is amoxicillin, and it's a high allergy medication. I will ask him to verbalize, and I'll also confirm from the doctor's orders. And he verbalizes that he doesn't have any allergy. So then I'll go ahead and spike and prime my tubing. I have a micro drip, which I'll be using today, and with my micro drip there's a spike which is supposed to remain sterile, because it's what I'm gonna be introducing to the fluid, and with the tubing comes the drip chamber. With the drip chamber, this is where I'm going to be able to visualize my medication. It is basically used to prevent air, visualize the flow rate, and also to help me count the flow rates. I also have the roller clamp, which is used to adjust and regulate the flow rate. This is what I'll be using when calculating, when I want to open or close the flow of the medication. I have the Y site, which is used to introduce the secondary line or the IV bolus. Piggy bank. This is the adapter chamber. This is what connects to my patient's IV sites. And I will go ahead and prime my tubing. So I'll go ahead and remove opened bag. I'm gonna go ahead and remove this. Go ahead and I will fill the chamber. I'll make sure that my clamp is closed before the drip start running down. So I'll go ahead and fill the chamber halfway full, the drip chamber halfway full, and that is it. I'll go ahead then and prime my tubing to make sure that there's no air trapped. And I have my roller up here, so I'm going to go ahead and hang this 30 inches above the IV sites. And I'm going to have the primary line lower than the secondary line. Then I'll go ahead and prime the tubing. Then I'll go ahead and close it. I will at this point clean my connection site to the IV, and since I don't have an IV, I'm not gonna do that, but in real life that's what I'm gonna do, and connect it to the IV site. Then I'll go ahead then and calculate my drip per minute. I'll be using 38 drops per minute on this one, so I'll go ahead and calculate that. So open the chamber. So I have that one taken care of, 38 drops per minute. Then I'll go ahead and take care of the amoxicillin. So with this, I also need to have a sterile. I don't want to introduce any dirt on my spike and the connection side, the Y side. So I'll go ahead and do the priming on the spiking and the priming. Go ahead and make sure that the clamp is crossed. Go ahead and connect to my Y site, but before then I need to prime to make sure there is no air trapped in here. Hang it on the upper side of the hanger. Prime it. Oh, before priming, I will fill the chamber halfway through. And then I'll go ahead and open the clamp and prime the tubing. I'll cross it. I need to connect the secondary with my, or before then I need to calculate and see whether I have 100 ml. I need to connect with my secondary, so I'll go ahead and clean my secondary connection, my Y side. So I'm gonna clean it with an alcohol wipe to make sure that it's clean and sterile. I'll go ahead and remove this and connect it to the Y tubing. I'll then go ahead and do my timing to make sure that I have 100 drops per minute on my secondary ring. I'll go ahead and do that. Started there. Okay, there you go, start. 100 drops per minute. I will then, having made sure that the IV site has no infiltration, phlebitis, any pain, any redness or swelling, I will go ahead and put my patient into a comfortable position and provide a Colrite. I will make sure that I dispose of the unnecessary supplies that I